The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Our shoulder is a ball and socket joint. The ball sits at the top of the arm bone, and the socket is part of the shoulder blade bone. The ball is made of bone, but the face of the ball is normally covered with a cap of cartilage, similar to a swimmer's cap. The socket likewise is covered with a layer of cartilage. So in a normal shoulder, we have a cartilage-covered ball that moves inside a cartilage-covered socket. Cartilage is very smooth. In an arthritic shoulder, for reasons that are not well understood, the cartilage is lost from the ball and socket. So in that situation, we have bone on bone rather than cartilage on cartilage. Bone is very rough, so it creates a very rough, painful shoulder. There are a number of treatment options that are available for management of the shoulder with arthritis short of surgery. Physicians commonly recommend modification of activities to pain tolerance, which is to say asking the patients to avoid those activities that are really bothersome for the arthritic shoulder. Physicians commonly prescribe anti-inflammatory medication or acetaminophen to manage the shoulder pain. Heat can provide relief of shoulder pain. It's not unusual for physicians to recommend a referral to physical therapy for a program of shoulder flexibility and then strengthening exercises. We occasionally use cortisone or steroid injections for temporary relief of pain. In the instance where those treatment options are not effective in relieving the pain from shoulder arthritis, surgery is an option in properly selected patients. Patients who are in reasonably good health tend to have better outcomes with shoulder replacement surgery. Smokers tend to have much poorer outcomes in terms of shoulder replacement surgery. There are certain medications that people have to take, but they tend to lower the final desired outcome. So patients that do the best with this surgery tend to be patients in general good health, patients who are well adjusted psychologically, and patients who are highly motivated to participate in the rehabilitation program. Several different procedures that a surgeon can use for the management of shoulder arthritis. The most common procedure, however, is known as shoulder replacement surgery. In this situation, the arthritic ball is removed, and then the ball is replaced with an artificial ball that sits on a stem that goes down inside the bone. That becomes the new smooth ball. On the socket side, the arthritis is removed from the socket, and then an artificial socket can be placed in the patient's socket once the arthritis is removed, and that becomes the new smooth ball and socket. That is the most common operation performed for shoulder arthritis. The rehabilitation after shoulder replacement surgery involves a carefully planned program of exercises that are designed to gradually restore a patient's range of motion or flexibility and to, over time, restore a patient's strength following shoulder replacement surgery. The program is typically initiated under the direction of a physical therapist, and the therapist and physician follow the patient along after the shoulder replacement surgery to progress the rehabilitation in hopes of restoring reasonable range of motion and strength over time. There are certain patients that are certainly better candidates for shoulder replacement surgery. Smokers tend to have poorer outcomes following shoulder replacement surgery. Patients who are on certain medications tend to have poor outcomes because those medications interfere or limit the healing of the replacement surgery. Patients that have the best surgical outcomes tend to be those individuals who are in reasonably good health, who are well adjusted psychologically, and who are highly motivated to participate in the rehabilitation program following the surgery.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.